Hello everyone and welcome to my channel. In today's video, I will be talking about a very important topic, that is the adenoid enlargement and the symptoms related to it, which is a leading concern for children and parents in today's world. So every one of us are born with adenoids. Just like the tonsil tissue, it is a group of lymphoid tissue which is present in the head and neck region, and just like any other lymphoid tissue, its role is to provide some immunity in the upper airway. By the time the child reaches an age of 6 to 7 years, the adenoids attain a peak size, and by the time they are teenagers, the adenoid tissue should completely disappear. We have to understand that disease is something that doesn't follow the normal path. Hence, a few kids suffer with adenoids enlargement or adenoids issue either right from the age of 2 to 3 years, or as they grow up, there is more suffering because the adenoid tissue has not disappeared as it should. Coming to the first symptom of adenoids enlargement, which is most noticeable in a child by the parents, is mouth breathing. We have to understand that mouth breathing is completely abnormal, and for a good growth, the child should be able to breathe through the nose freely. It is noticed by the parents usually when the child is sleeping, but some kids, even when they walk into my cabin or when they are sitting in front of me for an examination, I notice that their mouth is always open and they are in some kind of distress even during normal waking hours. The second most common symptom which accompanies mouth breathing is snoring and disturbed sleep. We all know that a growing healthy baby needs at least 10 to 12 hours of peaceful sleep. In children having adenoid enlargement, due to the constant mouth breathing and nose block, the sleep of a child is very disturbed. The parents usually notice that the child is tossing and turning in the bed or sleeps on their tummy. And when the child wakes up in the morning, they usually have some drooling which is present on the bed. The third and the most important symptom to be looked into is the child falling repeatedly sick or having repeated episodes of cold. This symptom is usually picked up by the pediatrician because when the child is sick, they are immediately taken to the pediatrician. Falling ill every other month or requiring antibiotics or medication every other month is absolutely abnormal, and the pediatrician should always refer the child to an ENT specialist before proceeding further. Fourth and the most disturbing symptom for the child is having repeated ear infection. That is, as we call it, repeated ASOM, acute suppurative otitis media. That is, pus being built up behind the eardrum in the middle ear. The children usually come crying in pain to the emergency, or few older children can even say that they are not hearing well. This episodes of ear infection is usually accompanied during his episodes of cold, and this happens because the eustachian tube, that is the tube connecting the nose and the ear, which lies at the back of the nose, is very straight in children. Hence, infection can easily travel into the ear for children. Along with that, if the adenoids are enlarged, the eustachian tube opening at the back of the nose gets blocked, and the infection which has traveled into the middle ear stays there, builds up, and causes immense pressure which is felt by the child. This is a very concerning symptom because if these episodes are not treated at the right time, the child can develop a hearing issue in the long run. Hence, having more than 2 or 3 episodes of ear infection every year should be considered as abnormal and an emergency situation to get an evaluation done. Next symptom to keep in mind is failure to thrive. That is, the child is not growing well or not putting on weight as he should according to his age. Now, parents usually tell me that in childhood, even we were lean and thin, and hence our child is also lean and thin. But this is not always the case. I do agree there are some genetic factors, But if the child is repeatedly suffering, repeatedly falling sick, having all the other symptoms of adenoid enlargement, they should seek medical attention and get evaluated by an ENT specialist. A lot of parents ask me that, as you explained, the adenoids disappear by the time the child reaches his teens. So, can we wait? I would say no. If the child is suffering, having constant snoring, mouth breathing, having a repeated cold, then we cannot let the child suffer in his younger years and wait till the adenoids have completely disappeared. Yes, there are certain situations where I give the parents an option to wait, but not when the child is suffering. If in case the adenoids issue was not detected in his younger years and not treated at that time, as the child grows, we doctors can detect certain features that tell us that this child was suffering with an adenoids issue and had constant mouth breathing or snoring issues when he was younger. This feature is called adenoid facies. First, we need to understand that mouth breathing is absolutely abnormal and nasal breathing is very important for the child's face and jaws to develop. When the child is constantly mouth breathing, it doesn't allow the facial bones to develop as they should. The upper palate or the hard palate develops like a tent, and the front teeth slowly start coming forward, and there is also overlapping of the teeth. Also, the child will have a very flat and dull face. Now, these problems are also detected by the dentist when the child is taken for treatment for their crooked teeth or the teeth coming in front. The dentist should always detect an adenoid issue and should always refer the child to an ENT specialist before doing their further treatment. These older children are also usually very dull and they don't do well in class because they have a very disturbed sleep at night and it is very difficult for them to concentrate in the morning or in class. Also, putting in a last point is that hyperactive disorder in younger children has also been linked to adenoid enlargement. Hence, in all ways, adenoids problem treated as early as possible gives the maximum benefit to the child. Hence, always seek an ENT opinion before you proceed for any kind of treatment. So now if the symptoms have been correctly detected and you have come to an ENT specialist, we do certain simple tests and x-rays to understand the size of the adenoids. Based on the size of the adenoids and the accompanying symptoms, we can take a call if your child can improve with medical management or if your child requires a surgical approach to treat his problem. So, this is a concern for most parents, and I agree that it is a very difficult and scary decision to be taken. But the medical field has evolved significantly during the last few years, and we now have sophisticated equipments and sophisticated procedures which we can do to ensure that the child has minimal risk during surgery and is comfortable even after the surgery. The children I operate on go home the next day happily playing with their toys. So I urge all your parents to not get influenced by the people around you or do not take decisions based on someone's experience in the past. Do consult an ENT specialist before you make any decisions to ensure that your child gets the best care as he is growing up. For more queries, you can book an appointment with me and I will leave the details after this video. Thank you and see you again.